What is the prognosis after lung cancer recurrence? When lung cancer comes back after treatment, many people wonder what this means for their future. The prognosis after lung cancer recurrence can be quite complex and varies widely based on several factors. These include the type of lung cancer, how soon it recurs, where it recurs, and the treatments available. Generally, a recurrence suggests a more challenging situation than the initial diagnosis, but survival rates can differ significantly. For patients with non-small cell lung cancer, or NSCLC, the median survival after recurrence is around 22 months. About 70% of these patients survive for 1 year after recurrence, and 44% survive for 2 years. If the cancer comes back within a year of the first treatment, or if the patient is older, the outlook may be less favorable. Factors such as being male or having a history of smoking are also linked to poorer outcomes. Interestingly, having certain genetic mutations, like epidermal growth factor receptor mutations, does not necessarily predict survival after recurrence. The type and extent of the recurrence play a crucial role in prognosis. Recurrence can be local, regional, or distant. Small cell lung cancer, or SCLC, tends to recur more frequently, with about 70% of patients experiencing a return within 1 to 2 years. This type of lung cancer generally has a worse prognosis than NSCLC. If the recurrence is limited to one area, it may allow for more aggressive treatment options, which can lead to better outcomes. After a recurrence, treatment options include surgery, chemotherapy, radiotherapy, and supportive care. Surgery, when possible, is associated with the best survival rates. Chemotherapy and chemoradiotherapy can also extend survival, with median survival times ranging from 30 to 35 months for selected patients. However, relying solely on supportive care often results in shorter survival times, typically under a year. Advances in immunotherapy and targeted therapies are showing promise for improving outcomes in some recurrent cases, especially for patients with specific genetic profiles. Several factors can affect the risk of recurrence and overall prognosis. Even patients who have early-stage lung cancer and undergo complete surgical removal of the tumor still face a recurrence risk of 13 to 23%, particularly if lymph nodes are involved. Adjuvant chemotherapy is often recommended for those with node-positive disease to help lower this risk. Additionally, smoking after treatment can increase the chance of recurrence significantly, highlighting the importance of quitting smoking for better lung health. Long-term outlooks after recurrence tend to be low, especially for SCLC with distant spread, where 5-year survival rates can be around 4%. However, survival statistics are gradually improving due to advancements in treatment options. Patients who remain cancer-free for 5 years after treatment have a lower likelihood of recurrence, but regular monitoring remains essential. In conclusion, while lung cancer recurrence typically indicates a more guarded prognosis than the initial diagnosis, survival outcomes depend heavily on various factors, including the cancer type, recurrence pattern, and available treatments. Early detection of recurrence and personalized therapy can enhance survival and improve quality of life. It is vital for patients to work closely with their healthcare team to understand their specific situation and explore treatment options.